Hey everyone, welcome to The Explainer. Today, we're taking a compassionate, real look at something that gets vastly misunderstood: compulsive overeating. Society loves to chalk up food struggles to just a simple lack of willpower, right? But as we unpack the clinical sources today, we're going to see that the picture is so much more complex. This is a highly valid mental health challenge that absolutely deserves empathy and evidence-based care. So, if you or someone you know has ever felt trapped in an endless cycle with food, you are in the exact right place.
Here is our quick roadmap for the explainer today. We'll define what compulsive overeating actually is, draw the line between overeating and binge eating, and then dig into the root causes. After that, we'll cover the signs and symptoms, the hidden health risks, and wrap up with some actionable pathways to recovery.
Section 1. What is compulsive overeating? Defining the struggle. When we talk about this condition, the key phrase you really need to hold on to is coping mechanism. It's characterized by chronically eating excessive amounts of food without feeling like you have any control, often way past the point of physical discomfort. But it doesn't just happen out of nowhere. It's usually a way to manage underlying emotional issues, things like stress, sadness, or loneliness. And then those episodes are almost always followed by intense guilt and shame, which just leads right into secretive eating. Realizing this helps destigmatize the whole thing instantly. It's actually the brain trying to soothe itself, not some kind of moral failing.
Section 2. Overeating versus binge eating, drawing the clinical line.
The clinical separation between these two is actually really interesting. Binge eating disorder, or BED, is a formal, recognized clinical diagnosis with strict rules. The episodes have to happen at least once a week for 3 months. Compulsive overeating, on the other hand, is an ongoing pattern that isn't always recognized as a standalone formal diagnosis in that exact same way. It usually gets categorized under OSFED or eating disorders. But listen, even if the frequency varies, compulsive overeating is absolutely real and it causes immense distress. The pain is valid no matter what clinical label it gets.
Section 3. Understanding the root causes. The why behind the behavior.
It is so easy to think we're totally alone in our struggles, but the data shows something else entirely. Roughly 13% of U.S. adults meet the criteria for food addiction behaviors that closely mirror compulsive overeating. That's millions upon millions of people. It crosses every age group, gender, and racial background. So if you are struggling, these numbers are proof that you are part of a massive, shared human experience.
And the sheer scale of this becomes even more obvious when we look at specific demographics. Among folks categorized as overweight or obese, that statistic jumps up to nearly 20%, 1 in 5. It really drives home the reality that this is a widespread, systemic health challenge that requires broad access to compassionate treatment, not judgment.
So, the absolute most crucial takeaway here is that compulsive overeating is not laziness at all. It's not a willpower problem. It actually develops from a deeply intertwined web of factors. Psychologically, things like depression, anxiety, low self-esteem, or past trauma play a massive role. And biologically, your genetics, family history, and even differences in brain chemistry or hunger hormones can make it physically harder to feel satisfied. We have to validate this as a real condition with complex roots.
Section 4. The signs and symptoms. Recognizing the red flags.
Let's start with the behavioral signs, the visible actions. This looks like eating way past physical hunger, or eating super rapidly. A massive indicator is secretive eating, like hiding wrappers, eating alone, or just avoiding social events entirely because of the anxiety around food. Another big flag is the yo-yo dieting cycle. People will heavily restrict what they eat, which biologically and psychologically triggers an inevitable episode of overeating. It's just an exhausting cycle to be trapped in.
Then we have the psychological signs. And honestly, this is where the deepest pain usually lives. The emotional toll is just staggering. We're talking intense guilt, shame, and embarrassment right after an episode. You might also notice persistent anxiety, depression, and obsessive, looping thoughts about food or body image. And very often, these signs tie back to a history of trauma, where the brain uses food to numb unresolved distress.
Finally, we have the physical signs, because the body really does keep the score. You might see noticeable weight fluctuations. Because the digestive system gets overwhelmed, folks frequently deal with severe bloating, constipation, or heartburn. Sleep gets disturbed, which leads to immense daytime fatigue. And since nutrition can be completely out of balance despite the sheer volume of food, you might even see things like hair thinning or brittle nails. It literally impacts the entire system.
Section 5. Risks and co-occurring disorders. The hidden dangers.
If this goes untreated for a long period of time, it carries some severe physical health consequences. The chronic stress on your body can lead to high blood pressure, high cholesterol, and type 2 diabetes. It also significantly bumps up the risk for sleep apnea, heart disease, stroke, and even certain types of cancer. So recognizing this early isn't just about feeling better emotionally, it is vitally important to intervene before these long-term physical effects can take hold.
Plus, this condition rarely operates in a vacuum. Studies show that most people dealing with compulsive overeating are also facing at least one co-occurring mental health challenge. We're talking depression, anxiety, PTSD, OCD, or bipolar disorder. They're incredibly interconnected. Someone might turn to food to cope with anxiety, and then the overeating deepens their depression. Because of this, any effective treatment has to be integrated. You have to treat the psychological pain right alongside the eating behaviors.
Section 6. Pathways to Recovery. Finding compassionate support. Okay, let's look at the clinical therapies that actually work. First up is cognitive behavioral therapy, or CBT. This equips patients to identify and reframe negative, all-or-nothing thoughts and manage their specific triggers. Then there's dialectical behavior therapy, DBT. This one is all about emotional regulation, giving you the distress tolerance skills to pause and handle intense emotions without immediately turning to food. Finally, acceptance and commitment therapy, or ACT, teaches folks how to observe their cravings without acting on them, helping them align their choices with their core personal values. Essentially, these therapies rewrite the brain's reliance on food. And there are very flexible levels of personalized care available, depending on what your life situation allows. Residential treatment offers 24/7 structured, medically supported care in a healing environment. But if you need to maintain daily responsibilities, partial hospitalization or intensive outpatient programs provide high-level daytime care while you stay at home. There's even virtual outpatient care now, which delivers structured therapy and nutritional support completely online. There's an option out there that can fit your life. Now, if you're a friend or family member trying to help, there are a few things you absolutely must avoid saying. Telling someone to just eat less or try a new diet might sound helpful in your head, but those oversimplifications actually do profound harm. They just reinforce that false idea that it's a willpower issue, which breeds more shame and pushes your loved one further into secrecy. Instead, here is exactly how you can cultivate a positive environment. Listen with deep empathy without offering quick fixes. Avoid making their weight or eating habits the focus of conversations. Just reassure them that they aren't alone, gently encourage them to seek professional help when they're ready, and celebrate the small, everyday wins. Recovery takes time, and your non-judgmental support is truly the greatest gift you can offer. Which brings us to our final thought. If you recognized yourself in this explainer today, I want to ask you something. Are you ready to take that first step toward understanding your relationship with food and giving yourself the compassionate care you deserve? Asking for help is not a weakness. It is the brave, totally necessary beginning of healing. Thanks so much for joining me for this explainer. And remember, a healthier, more balanced life is entirely possible.